So the first one we'll jump into, this is definitely top. If you just took one test away, this is it. So we'll start with at number one, which is your vitamin D. All right. You should know your vitamin D status. Supremely important. Thankfully, it's getting more out there within the public domain and awareness, right? And even amongst at the primary care level, but supremely important. I first clued in on this when I was in residency, actually at the Mayo Clinic, and we had a chronic pain rehabilitation program. So this is outpatient. Patients come, chronic complex pain problems. The pain problem can't get solved, so it's all about how to cope with it and deal with it, like mind-body techniques, gentle physical therapy, things like that, weaning them off their narcotic medications, that type of thing. Well, turns out that there's a strong correlation between very low vitamin D levels and chronic pain. Okay, if I took your vitamin D level and just dropped it far enough, you'd develop widespread pain. It would look and act like fibromyalgia. Since we were in Minnesota, this was potentially quite possibly a problem, right? And so I was noticing on the intake labs for these patients at the Mayo chronic pain program, no one was checking a vitamin D status. We had standard, certain battery of labs that we would order, and vitamin D wasn't on there. And I told the director, I was like, I think we should look into this a little bit. In fact, one of the groundbreaking studies on vitamin D and chronic pain was done by another gentleman up at the University of Minneapolis, or University of Minnesota, rather, in Minneapolis. And so I said, we need to look into this. Short answer, by the time I got done, it had become standard practice to do that as an intake. And we found out that a good proportion of those patients were low in their vitamin D. And in fact, the patients who tended to be on the most narcotics, AKA presumably having the worst pain, were also the same group that had the lowest vitamin D levels. So we know that it's extraordinarily important. So furthermore, interesting thing about vitamin D is it's actually misnamed. Okay, it's misnamed. It's a hormone. Is a hormone in your body. It's no different than thyroid hormone, adrenaline, cortisol. It is a hormone. When it first got discovered, we were thinking it was a vitamin, but basically medical science and knowledge progressed past that, and it's a hormone. But what's unique about it is it's a hormone that requires sunlight to be activated biologically. So your body produces the pro-hormone or the precursor hormone and requires sunlight to activate it. So it's kind of interesting. So in that sense, human beings are kind of like, that chameleon or that gecko, you keep it in a little terrarium, but you got to get its little UVB light too, right? Or else it's not going to be healthy. We're the same way. We're actually supposed to have some sunlight hit our skin on a daily basis, or we're not going to be healthy as far as vitamin D goes. So, and the challenge, I'll stop in a second, we could talk about it, but I'll just end by saying this. Very important, but the challenge is it's typically hard to keep the vitamin D levels up, right? So number one, people are indoors most of the time. Number two, if they are outdoors, they're covered up or they're wearing sunscreen, which defeats the purpose because it's the same UV rays that create a tan also create vitamin D. So to put sunscreen on is the same thing as blocking vitamin D synthesis. And of course, people are concerned about possible skin cancer, sun damage, etc. So the flip side of that, though, is the vitamin D synthesis drops off. And especially if you live at a northern latitude, it also drops off. And that just has to do with the angle of the sun. So at the equator, the angle of the sun is coming straight down. There's really a small column of atmosphere, right, through which the sun has to hit until it hits land. Northern latitude is low in the sky. So if you just think about like the volume of atmosphere, in like a rectangle to reach out to the rays of the sun, by the time it comes down at an oblique angle and hits you on land, there's a whole bunch more atmosphere basically between you and the sun, which is why it's not as hot and the sun's not as heavy during the day. Well, it also means less UV rays are getting through, and there's less opportunity to even synthesize vitamin D. So even if you went out at northern latitudes like Washington State, during the middle of the day in a tank top or whatever, we're trying to get some vitamin D, it's a lot harder, probably by a couple orders of magnitude than, if you were in Mexico at the same time. So that's a brief overview. I don't know if you want to comment on that. We could talk also about specific things vitamin D does in the body, but that's kind of the problem there in a nutshell.
Janet, what questions do you have for Dr. Turner?
Well, I just wanted to add too, one of the things too that people don't realize as well is if you come in the house and you shower, you stop that process. So, we feel like it's going to be ongoing, but it's not. So we have a short window on that. But yes, let's jump into what the benefits are of vitamin D, because I think we all just think about bones, but there's other things that it does for us.
Way beyond. So one of the interesting things was in my background as rehabilitation specialist, what it can do in the elderly and what it does as far as muscle fiber density and power output. So fast twitch muscle fibers are highly influenced by your vitamin D level. And so they've done these studies where they look at elderly people, and they can see that the lowest levels of vitamin D are the people who are most unsteady, take the most time to get out of their chair, take the most time to walk across the room, have the greatest fall risk. Then they follow that up by actually repleting their vitamin D levels and watching all those numbers get better. So it's pretty striking. So you could take grandma and perk up her vitamin D level, and she actually got out of her chair faster, walked across the room faster, and had less overall fall risk. Okay, and that has to do with fast twitch muscle fiber density and vitamin D status. That was pretty, striking to my mind. Also, hugely involved in the immune system. So let's just say any illness. Let's just say COVID, for example. Okay, we all know about vitamin C. We know about vitamin or zinc, for example. Vitamin D also, you have an increased need of vitamin D when you are acutely ill with any illness vis-a-vis the immune system function. So it becomes very important. And also, related to the immune system is autoimmune disease, right? So we know that autoimmune disease risk of development is much less with vitamin D status being adequate. And we also know that if you do have an autoimmune disease, like multiple sclerosis would be an example, if we keep your vitamin D levels high, the severity of that disease goes down. It's actually considered a treatment, for multiple sclerosis. Also, cancer. Vitamin D has strong anti-cancer properties. If you want to just do a little internet search about vitamin D and cancer, you'll see that it inhibits cancer in a number of different ways. And so integrative cancer docs will want their vitamin D levels of their patients very much higher than even your typical primary care might.
And what about dosing?
Yeah, so it's a great question. So partly it depends on first getting your level, because the metaphor I would use, it's kind of like how full is your gas tank, right? If you're truly on empty, you need to fill your tank first and then top it off. So the filling doses of vitamin D, if you're very low, are typically like 50,000 units once a week, as you may know, oftentimes 8 weeks, 10 weeks, 12 weeks, something like that. If you have a sufficient level, then maintenance dose is usually 4,000 to 6,000 IU international units a day. If you don't know what's going on, you don't have a level and you're just guessing something, you're not going to go wrong being at 4,000 to 6,000. It might just take you quite a long time to ramp up to optimal, let's just say, Yeah.
Cool.
If you're acutely ill, by the way, if you're acutely ill and you don't have a chance to get a level tested or anything, 10,000 is fine. That's safe. Okay. If you're sick tomorrow with COVID or whatever, you could take 10,000 over the counter every day. You'd be all right.
Yeah, there's been a lot of safety studies that have shown that even up to, I wouldn't recommend this, but even up to 40,000 units of vitamin D every day is probably safe without side effects. And I think one thing the analogy I always give is like, if we were to sunbathe naked for 20 minutes, we produce 20,000 units of vitamin D. So to think that you can overdose on 10,000 units a day is probably pretty crazy.
Good point.